The fentanyl addiction crisis magnifies a deep-seated public health emergency in the US and Canada. Fentanyl, a synthetic opioid known for its potency, has emerged as a pressing threat to countless lives. At the heart of the crisis are staggering overdose death statistics, with fentanyl implicated in over two-thirds of the more than 100,000 drug overdose deaths recorded recently in the US. This alarming trend is driven by the drug's potency, as even a scant 2 milligrams can prove fatal. The proliferation of fentanyl is rooted in illicit manufacturing and trafficking networks. Synthetic fentanyl finds its way into heroin, cocaine, and counterfeit prescription pills, unbeknownst to users, thereby heightening the risk of fatal overdoses. Communities across urban, suburban, and rural lines are ravaged by its impact, with vulnerable demographics bearing the brunt of the crisis. A particularly unsettling factor is the prevalence of overdoses among youth, stemming from counterfeit pills resembling Xanax, OxyContin, or Adderall. The logistical web fueling this epidemic extends across borders, with Mexico acting as a primary trafficking conduit, often with chemical precursors sourced from China. Despite record extraordinary seizures by U.S. Border Patrol and law enforcement, the flow persists. To mitigate these dire circumstances, harm reduction stands at the forefront. Naloxone, known as Narcan, offers a lifeline by reversing fentanyl overdoses. Fentanyl test strips provide users with the ability to identify fentanyl presence in drugs. Supervised consumption sites and medication-assisted treatment programs emerge as critical supports for individuals grappling with addiction. Navigating the labyrinth of solutions and challenges requires broadening access to recovery initiatives and intensifying efforts to dismantle international trafficking networks. Confronting the root causes of addiction, which lie entrenched in societal issues such as mental health and economic instability, is essential. Efforts to amplify public awareness about the perils of fentanyl-infused drugs are vital in turning the tide of this crisis. Understanding the multifaceted dimensions of the fentanyl epidemic is crucial in devising and implementing effective strategies to curtail its pervasive grip on society. Such strategies necessitate a concerted effort from policymakers, healthcare providers, law enforcement, and the community at large. These efforts aim to pave a path towards recovery and resilience, addressing the fentanyl crisis comprehensively.